If you're dealing with lower back pain and you're worried about making it worse, this routine is designed with you in mind. This isn't an aggressive workout. It's a gentle, controlled approach that prioritizes your comfort and safety. You're in complete control here, and nothing in this video should push you past what feels right for your body. Why mornings trigger lower back pain? After a full night of lying down, your spine has been compressed, your discs have absorbed fluid, and circulation to your lower back muscles is reduced. That's why many people feel stiff or achy first thing in the morning. Jumping into aggressive stretches or sudden movements can actually irritate already sensitive tissues. What your body needs instead is a movement reset, something that gently reintroduces range of motion, warms up the muscles, and restores circulation without forcing anything. This routine does exactly that. It's designed to ease you out of stiffness, not shock your system into submission. As you move through this, mild tension, light stretching, or a gentle warmth in the muscles is normal. Sharp pain, shooting sensations down your leg, or any worsening of your symptoms is not. If something doesn't feel right, slow down, reduce your range of motion, or skip that movement entirely. You have full permission to modify anything. This routine includes 7 movements. Each one takes about a minute. You don't need any equipment, and you can stop at any point. There's no pressure to complete everything if your body is telling you otherwise. Movement 1. Gentle rebounding/foot tapping. Start by standing, with your feet hip-width apart. Gently tap one foot at a time, letting your heels lift slightly off the ground in a soft, rhythmic motion. This isn't jumping. It's more like a gentle bounce or marching in place. If even that feels like too much, you can simply shift your weight from side to side. This movement helps wake up your lower body, increases circulation, and gently loosens stiff joints without placing stress on your spine. It's a low-impact way to ease into movement after being still all night. Movement 2. Controlled standing rotation. Stand with your feet shoulder-width apart and place your hands on your hips, or let them hang comfortably. Slowly rotate your torso to one side, then back to center, then to the other side. Keep the movement small and controlled. There's no need to twist as far as you can. Breathe naturally as you move. Loss of rotational mobility in the hips and mid-back often increases strain on the lower back. By gently restoring that rotation, you're helping your spine move more freely and reducing compensatory stress in vulnerable areas. Movement 3. Supported downward-upward flow. Stand with your feet about hip-width apart. Place your hands on your thighs for support. Gently hinge forward at the hips, letting your spine round slightly as your hands slide down your legs. Then, reverse the motion. Lift your chest, extend through your spine, and return to standing. Move slowly and breathe with the motion. You're not trying to touch the floor or force a deep stretch. This movement gently cycles your spine through flexion and extension, which helps restore the natural curves of your lower back. It also engages your shoulders and hips, distributing the workload and reducing isolated stress on any one area. Movement 4. Seated straddle mobility. Sit on the floor with your legs spread comfortably wide in a straddle position. If sitting on the floor is uncomfortable, use a cushion, sit against a wall, or perform this from a chair. Gently reach forward between your legs, or lean to one side and then the other. Move only as far as feels comfortable. There's no benefit to forcing a deep stretch here. Tight hips, especially in the inner thighs and hip flexors, often contribute to lower back discomfort. By gently opening up this area, you're reducing tension that can pull on your pelvis and lower spine. Movement 5. 90/90 hip rotations. Sit on the floor, with one leg bent in front of you, at roughly 90 degrees, and the other bent behind you, also at 90 degrees. If this position is too challenging, sit on a cushion or modify the angle. Slowly lean forward over your front leg, then rotate to bring the opposite leg forward, and repeat on the other side. Move slowly and deliberately. If you're able, you can lift your hips slightly as you transition, but only if it feels controlled and comfortable. Hips that lack internal or external rotation often force the lower back to compensate during everyday movements, which can drive recurring pain. Movement 6. Supported Cossack squat. Stand with your feet wider than shoulder width apart. Shift your weight to one side, bending that knee while keeping the other leg relatively straight. Your heels should stay down on the bent side if possible. Use a wall, chair, or countertop for balance if needed. This is a lateral squat, and it combines both strength and mobility. Move slowly and only go as deep as feels stable and comfortable. Lateral strength. Your ability to control side-to-side movement is often overlooked, but it plays a critical role in protecting your spine during daily activities like bending, lifting, or turning. Movement 7. Windshield wipers. Lie on your back with your knees bent and your feet flat on the floor, about hip-width apart. Let your knees gently drop to one side, pause, then bring them back to center and lower them to the other side. Keep the movement slow and controlled. You're not trying to touch the floor with your knees. This motion gently rotates your lower back and pelvis, which can help relieve tension in the SI joint and lower lumbar area. It's a decompressive movement that doesn't force end ranges, making it safe for most people dealing with stiffness or discomfort. Results and expectations. Gradual improvement is the goal here, not instant relief. Consistency matters, far more than intensity. Doing this routine regularly may help reduce stiffness and improve mobility over time. But it's important to understand that feeling better after a movement session doesn't mean the underlying issue is fully resolved. Relief is a positive sign, but long-term improvement often requires understanding what's actually causing your pain. If your pain keeps returning despite staying active, the next step is clarity. Understanding what's driving your symptoms can make all the difference. If you'd like help figuring that out, our contact information is on the screen. There's no rush, no pressure, just support when you're ready for it.